There are many different ways that you, as a friend or family member of a person who has dementia, can lend support to that person as they go about their daily activities. You can help by remembering that they are still the same person and friend that you may have known for a long time, including them in group conversations, asking them for their opinion, and not assuming that you already know what they want, offering your support because they may not feel confident enough to approach you and may need your assistance, being sensitive. Here in this video, we will talk about how you can help people with dementia and can treat them in the best way. The video is going to be very interesting, so make sure you stuck at end. Before we continue to our video, make sure to smash the like button, subscribe to our channel, and hit the bell icon to never miss any of our future uploads. Now let's get started. 1. Be flexible. A person who has dementia will, over time, grow increasingly dependent on others. Maintaining flexibility and adjusting both your routine and your expectations according to the circumstances might help reduce feelings of frustration. For instance, if she or he likes to wear the same outfit every day, you might want to consider purchasing a couple sets of clothing that are identical. If taking a bath is met with resistance, you might want to think about doing it less frequently. 2. Reduce frustrations. When actions that were formerly easy become challenging, a person who has dementia may experience increased agitation. You should, in order to minimize difficulties and reduce feelings of frustration, reduce the number of distractions to make it simpler for the person with dementia to concentrate during meals and talks. Turn off the television and reduce the number of other distractions as much as possible. Participate with the individual. Give the person with dementia as many opportunities as possible to take care of themselves with the least amount of assistance as feasible. For instance, if you put out the person's clothes in the order that they should be worn, he or she may be able to dress themselves alone or set the table independently with the use of visual clues. Make a thoughtful schedule, establish a routine, and stick to it for yourself. Certain chores, such as taking a bath or attending to the doctor's office, become considerably simpler when a person is at their most alert and refreshed state. Leave some wiggle room in your schedule in case you encounter some unforeseen obstacles or the day proves to be particularly difficult. Take your time. Prepare yourself for the chance that certain activities will use more time than they have in the past, and make sure you give yourself sufficient additional time to finish them. When you are working, it is essential to make time in your schedule for breaks. Provide choices. On a daily basis, there ought to be some choices accessible, but not an excessive quantity of them. You may, for instance, present them with 2 distinct options for an article of clothing to choose from, query as to whether they would rather consume a hot or a cold beverage, or inquire as to whether they would rather go for a walk or watch a movie. Provide simple instructions. Communication that is uncomplicated and only requires one step is the kind of communication that is easiest for people with dementia to comprehend. Limit napping. Reduce the number of naps you take and try to avoid taking naps that are too lengthy or too many throughout the day. Because of this, there is less of a chance of having the days and nights confused up with one another. 3. Create a safe environment. It is more likely for a person to become injured in an accident if they have dementia. This is due to the fact that dementia impairs both judgment and the ability to find solutions to issues. In order to improve people's perceptions of their own level of safety, take fire safety precautions. Put lighters and matches away in a place that is difficult to get to. If the person with dementia is a smoker, then they need to have their cigarette breaks closely monitored at all times. Make sure that there is quick access to a fire extinguisher and that the smoke alarms and carbon monoxide detectors have had their batteries replaced within the past few months. Prevent falls. You should steer clear of anything that can cause you to stumble, such as extension cords, scatter rugs, and clutter. In areas that present an elevated risk of injury, the installation of handrails or grab bars is strongly recommended. Use locks. You need to avoid anything that can cause you to fall, such as extension cords, scatter rugs, and clutter, so you should steer clear of these things. In locations that have a greater potential for individuals to sustain an injury, the installation of handrails or grab bars comes highly recommended. Check water temperature. Reduce the temperature of the hot water heater so that no one will be hurt from the extreme heat. Hope you guys enjoyed our video. Make sure to subscribe to our channel and hit the bell icon for more videos. Thanks for watching and have a wonderful day.